Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association. That's NALBA for short. Thank you for joining us today for our series called Pláticas, Latino Wellness During COVID-19. NALBA is a nonprofit organization that's dedicated to the well-being of Latinos in New Mexico and across the United States. Our mission is to address the disparities affecting the behavioral health of Latinos. We're excited to host this Facebook Live series on how Latinos and their families can and do take care of their emotional, physical, and spiritual well being during COVID 19. We're excited to host this Facebook Live series on how Latinos and their families are able to address these issues because they're vital to our lives and who we are. I'd like to thank our strategic partner, Morehouse University School of Medicine, for helping make this series possible. Each month in 2021, NALBA will host a professional expert in public health, behavioral health, and the field of medicine, as well as advocates and community members who can share their insights, their expertise, and their experiences on taking care of themselves, their family, their community during the COVID 19 pandemic, and also what resources are available to help. Today, we'll be listening to a powerful personal story and having been hospitalized, and our guest will be able to share that story today. We're excited to be able to listen to his story in just a moment. However, we're also going to add a little bit of information about the Pass It On research study, and we'll be joined by one of our presenters who I'll briefly introduce in just a second. To get us started, here is how the Plática will work. I have several questions to get us started, and I would like to encourage you, the listening audience, to send in your questions, or if you have some comments that you'd like to type in, we'll share that with our presenters because then this way they'll have an opportunity to respond to your questions or comments. And with that having been said, I'd like to welcome our presenter to today's event. And Robert, I'm going to read your bio here briefly, just to be able to give the listening audience a little quick snapshot about you. And then when we get started, I'll ask you to say more about yourself. But welcome and let's get started. Robert Apodaca. Robert was appointed by President Barack Obama as the Assistant Chief of the West with the United States Department of Agriculture, where he focused his efforts on 13 state region area of conservation and water initiatives. Robert also served as an appointee to Governor Bill Richardson, where he worked with local, tribal, state agencies on fiscal and budget policy. Of course, during that period of time, when he was working in the state of New Mexico, he and I were both appointed by the governor. So it's great to see him both here today as a colleague and a cohort and a former co-worker. And but quite frankly, Robert, this is what I really appreciated your bio. I love the way you culminated your bio and by saying that Robert is a native New Mexican who is dedicated to creating better communities for Americans through communication, collaboration, equality, and hard work. And with that, Robert, it's good to see you. It's great having you here today. We'll be joined by Dr. Raval during the course of today's presentation, but we're going to get started with you, Robert. And with that, I'd like to just give you a moment to say a little bit more about yourself and tell folks who Robert Apodaca is.
Thank you, Fred. Hey, great to see you again. Yeah, it's been a while. Working back in the Richardson administration with you. We've known each other for a while, so it's glad to be here. Maybe in a little bit different circumstances, but yeah, thank you for inviting me to your show today. And yeah, just a little bit about myself. Yeah, born and raised northern New Mexico. My family's been up in the Taos County area, actually. Arroyo Seco, New Mexico. My great grandfather homesteaded there back in the early 1800s. So we have a huge family of Martinez's and Apodacas in northern New Mexico. But yeah, just kind of the I think the typical story of of how us Hispanics and Latinos grew up in northern New Mexico. You know, very rich in culture, our heritage, our language. You know, the water and the land are very important to us. Our you know, my father, you know, worked up at the mine in Cuesta, New Mexico for 40 years.
Wow.
So really, you know, and my mom was, you know, luckily able to stay home with us until we, you know, graduated, you know, from high school. Honestly, you know, we grew up in a very modest upbringing. I honestly didn't realize I was poor till I went to college. You know, and just, you know, really, you know, I'm blessed. Really good, solid family. My parents are still with me, with us. I'm still, you know, very grateful for that. They're, you know, they're healthy for the most part. But you know, also, you know, been impacted with this COVID, and you know, trying having to see kind of what I went through without being able to come and take care of me, or you know, they don't really know how to do video chats, and just you know, so it's been a very interesting situation, you know, through this whole process over the last, you know, 2 to going on 3 months over here. But yeah, just you know, just first one to go to college, you know, from from my family. So I'm, you know, very proud of that. Graduated from New Mexico State University with my my business degree. You know, worked in various aspects of, as you mentioned, appointed by Governor Bill Richardson at the Department of Finance Administration. Worked on a number of community initiatives throughout the whole state. You know, after that, worked with, you know, got an appointment with President Obama with the U.S. Department of Agriculture, and as you mentioned, kind of overseeing, you know, 13 state region on agriculture, conservation, and water initiatives, tribal initiatives, U.S.-Mexico initiatives. You know, great experience. You know, great people. And then after 3 years in the administration, I, you know, and I was actually stationed here in New Mexico, which was great. But after 3 years, I stepped aside, and you know, for family issues, and I started my own consulting business. So over the last 8 years, I've been doing consulting, and really, you know, working with our communities on these same issues,
Nice.
on health initiatives, behavioral health initiatives, building capacity, you know, water infrastructure, just, you know, again, just working within the communities to try to, you know, help our communities, you know, prosper and be successful. So you know, I've been lucky. I've worked hard, and I have, you know, 2 daughters that you know, are also trying to mentor them and teach them, and you know, and work in our communities, and just you know, you gotta, you know, be good stewards of our communities, and our people, and and you know, and our land. And it's but so anyway, that's a little bit about myself, Fred. Great to be here. Thank you for allowing me to just, you know, share my story a little bit.
Absolutely, Robert. Yeah, it was so telling that our paths have crossed several times,
Yeah.
and which means we're going to be inseparable, Robert. That's really what that means, for especially since we'll get to go to each other's matanzas at, you know, at some point post COVID, you know.
Yes,
Uh,
exactly.
but uh, let's get started. I want to just say thank you for uh, making such an effort to come share your story. In large measure, after we talked, it was pretty clear to me that what you had to say was invaluable, and it means that your willingness to share. It can be informative, educational, but it's coming from our heart, comes from our real life experience. And in northern New Mexico, we have a very long history of storytelling.
Yes.
And so we grew up that way, right? My mom taught me with the use of proverbs, life lessons, and the wisdom that comes from that insight that's culturally and linguistically based. So Latinos really understand the world around them. You're right. I said never understood what the word poverty meant because I never felt I was poor or never felt impoverished. I realized it was a label that was given to us from the outside, but I never felt that way and
Yeah.
have never led my life that way. So I feel very rich with my personal identity, our culture, our heritage, and you know, you will keep those traditions because your storytelling will help tell your children and your grandkids and your family what's important to us, what we value, what our cultural beliefs are. And so we're going to have that opportunity here to do that. And so when we visited, you had a chance to kind of share with me your experience dating back to December 2020. So that's a big milestone because most of us, as we're getting ready for the holiday season, Robert's path changed in December. So, Roberto, I'm going to just hand it over to you and let you get started.
Okay. Yeah, thank you, Fred. So, yeah, with respect to just the whole storytelling, you're right. That's kind of the way we grew up. But also, I'm not sure if you grew up the same way, but also, we're generally very private. I don't. I normally don't share these stories like this. It's just not the way that I grew up. They're very personal. But this is something that I really felt I needed to kind of share, especially with everything that's going on. How politicized this whole COVID-19 issue has become, and even seeing some of my family and some family members and some friends, and how they don't necessarily have all the information or quite understand of how real this could be and how detrimental it could be. So yes, I back in December, it was actually December 23rd is kind of, I actually started feeling a little bit, started feeling some symptoms on December 22nd. You know, historically, once we kind of, the whole COVID, started arising, I have what I kind of call a COVID bubble. We really kind of kept it small. I always believed that this has been an issue. We masked up. We weren't going out really and socializing. If I had to go out to the grocery store or go run errands, wore the mask, socially distance. Try to adhere to all the different recommendations that were out there. So to
Right.
this day, I don't quite know where I got it. I think right about the time for Christmas, I went grocery shopping. I was masked up, so I don't quite know, but I know December 22nd, I started feeling just some symptoms. For Christmas, me and my two friends were gonna do a small matanza where it was just gonna be the three of us, where we were gonna
Right.
throw, some meat in the ground and just kind of for our families to get ready for the Christmas holiday. So on the 22nd, I called my buddies and I said, "Hey guys, I'm just starting to cough a little bit. I'm not feeling too well, so maybe we should kind of hold off on this matanza thing." So they said, "Well, let's play it by ear for tomorrow, because on the 23rd we were going to kind of throw our meat in the ground and whatnot." So the 23rd, me and my daughter went to get a rapid test. The test came out negative. So I called them up. I'm like, "Hey guys, I'm negative." So they're like, "Okay, well let's do this, right?" So, but
Right.
even at that, I mean, we were outside, we were masked up. Um, we did what we needed to do with the matanza. We split up the meat and everything else, and I think we may have actually had like just to be for precautionary measures. I think we might have had a drink outside, just to kind of make sure we were indoors.
Sure.
So yeah, the 23rd, we divvied up the meat and whatever else, went to bed, and those were really the first major symptoms I started having. Probably for the next 5 days, I would go to bed. I started having the fever, my back. So it's kind of interesting the way that the virus hit me, and it's hitting everybody differently. I'm fairly healthy. I don't have any underlying issues, but the first probably 4 to 5 days, the virus, I really felt the virus was like attacking various parts of my body. Like the first night that I woke up, I felt like somebody was just had a bat and was going at my back, just pounding on me. I got up, my back is sore, and I'm just in a lot of pain. The next night, my legs, again, same thing. Like if somebody was just hitting me with a bat on my legs and just getting up very sore, and still having the fever and whatnot. And at this point, it's a slight fever of probably a 100.3. The third and the fourth nights, various aspects, but even at that, I remember very distinctively the bottom of my soles, literally, like, even getting up, and I could barely walk because, again, like somebody had been pounding on the bottom of my soles. It was just very odd. I almost felt like it was making its way to various parts of my body to see where my weaknesses were.
Right.
So as we, as we ended up getting to, day number 7, I went to starting to feel my chest was heavy. I went to the emergency room just to kind of make sure nothing was wrong. They did do an X-ray, and they said that I had some COVID pneumonia. But they said that I was not, I was not sick enough to be admitted to the hospital. So they said, here's some oxygen just for in case. Gave me the little pulse oximeter to kind of keep an eye on it. Came home. So I was home for about 3 days. And, on the third day, I just saw that my oxygen levels were not going higher than 85. Every time I'd get up, I would see my oxygen start crashing. And one thing I forgot to say is that, one of my best friends is an MD, he's a doctor. So,
Gosh, right.
So I called him, and I was like, hey, Freddie, what's going on? And so he's like, you need to get yourself to the emergency room. So just like, as, Latinos, Hispanics, we figure this out on our own, right? So I put my oxygen in my car. I drove myself, which was probably not the smartest thing to do. When I got to UNM Sandoval, I parked the car when I walked in, and they got me very quickly. But by the time they took my oxygen, and I was at 55% when they actually, actually put me in. So, they were like, they put me on oxygen right away. They admitted me right away. They were telling me they didn't know how I actually even made it into the hospital, right? So that was kind of the beginning of the first of, I think, 13 days in the hospital. As you're in the hospital for COVID, I mean, really the COVID ward is shut off to everybody, so you can't have any visitors. My oxygen continued to stay fluctuating. On day number 4, it's kind of interesting. This was the first real awakening that I had. The doctor showed up at my room at about 11:30 at night, and she woke me up. She says, "Mr. Apodaca, says your oxygen levels are not stabilizing. If we don't see you stabilizing within the next 24 hours, we're going to have to get a room ready for you in the ICU. If we take you down to ICU, there's a good chance that you're going to have to be intubated. And if you're intubated, you just need to understand that your chances of survival drop by about 50%. And at this point, I am like, literally, I just waking up, and I'm like, time out here, hold on. That I was not ready for that, or even emotionally, right? So literally all night long, I didn't sleep a wink, trying to do whatever I could to focus on getting my oxygen levels stabilized. The other aspect, which was very, I mean, to this day, it's still hard and even traumatic, is I didn't know what was going to happen to me. I didn't know if I was going to go into ICU. I didn't know if I was going to come out. My daughters, my 2 daughters, I sent, literally from 12 o'clock midnight to about 3 a.m. I was literally texting them saying, "Loquitas, this is what they're telling me. I don't know if I'm coming out. God forbid something happens to me. You need to know all this information." So I started sending them literally, these are my bank accounts. These are the passwords. You need to contact, if I pass away, this is contact my insurance person, and blah, blah, blah. So, I mean, literally a list of different items that they needed to do if I didn't come out of this, which, they wake up at 7:30, and they're like freaked out. right? And luckily they didn't put me in ICU, but that's a reality of the stuff that I was going through in my head at the time. So, you know, thank God they didn't have to put me in the ICU, and I was in the hospital for another, so 13 days total. They released me. I probably, you know, I had kind of met all the benchmarks, but I really wasn't ready to come home. But I was so ready, just because that's the first time I've ever had to be hospitalized, or even in the so they let me home, but before they let me go, the doctor said, and this is probably after 22 days, he says, Robert, you're probably still contagious, so you need to be careful of having anybody at your house, or if you do, quarantine and whatnot. And again, being like kind of the prideful people that we are, I was
Right.
not wanting to ask for help. I was like, I decided to come home and do this by myself, which was probably one of the worst decisions I could have made, because my oxygen was still declining as soon as I stood up. I mean, I would literally, when I got home, wake up in the morning, stay in bed for the next hour and a half, just trying to figure out how am I going to put my pants on, because the second I stood up, I was deciding, and I had to just go back to bed. And luckily I had so many people that were bringing me food, helping me out, friends and family. But even at that, it was difficult. So fast forward 7 days into this whole process. So I'm on oxygen this whole time, right? And
Right. Right.
so when I was at UNM Sandoval, they're probably pushing up like 50 liters of oxygen into my body, which is a lot. They won't let you out till you're at 3 liters. I come back home and I'm back on about 4 or 5 liters. But the oxygen is really making my nose and whatnot very raw and sore. So I called and asked for a humidifier to be put onto my oxygen machine. So thinking that they would come and install it for me, but because of COVID, they didn't want to come in. So so on a Thursday, so I think this was on a Thursday, I'd gotten up to take a shower. When I got into the shower, I was probably at about 92% oxygen level, but it was still desadding as I was going through this process. Within 10 minutes, probably fell to 85. At which point the people from the oxygen supply place came, and so I had to kind of trek my way to the front of the house to get the humidifier. So kind of going back and forth. I'm not sure if I wasn't thinking straight at the time, but I didn't realize when I had to install the humidifier that I was going to have to disconnect my body from the oxygen that I was getting.
Oh,
so at this point, not being able to rest or whatnot, I'm probably already in the 70s of my oxygen level. And at the point in time when I disconnect myself from the oxygen, who knows what I fell to, but I threw myself into a relapse. I immediately felt my body react, and again, my oxygen level wasn't going past, probably 85, and I also didn't call my buddy, the doctor, till the next morning, because I was hoping I was going to be able to sleep through it and just, get this, and I was going to feel better, which was probably a bad mistake from my point also. So I called him. He comes to check on me the next day, and tells me, he's like, Rob, you know what? We need to take you back into the hospital here. And I was fighting him on it, because the only thing that I could think about was, being sent to ICU and being intubated and not coming out of the hospital. So it was a very scary process. And luckily he made me go. The one thing that the doctors told me, and I remember they were saying, when I got there, they said, Robert, we might have to take you to UNM downtown, to the University of New Mexico. And I didn't quite understand why, but they finally did. Fast forward, so I got out in about 7 days after that. My buddy, Freddie Diaz, the doctor, he's also my, one of my best friends, but my primary care doctor. He got the results a couple of weeks ago. So about a week ago, he comes to my house and says, Rob, he says, I don't think you quite understand how lucky you are. He says, when you went to the hospital the second time, your heart was at 160 beats per minute. You know, trying to get oxygen to the rest of your body. He says they were literally preparing for you to go into cardiac arrest.
Oh my gosh.
And he says if you would have stayed another night, it's like it's a good chance you may not have made it out. I mean, luckily, I'm going on week number 5 of being out of the hospital. It's literally been about 5 days that I've gotten off oxygen. So I'm doing well, but I've literally had to start from scratch of just recovery. Starting off with 500 steps a day. Yesterday I made my from 500 steps to 1,000, 2,000. Yesterday I was up about 2 miles, but it's been like having to train myself all over again, and it's been a very interesting, scary, and a bunch of different thoughts go through your head. So anyway, that's kind of the story that that's kind of my story, what I've been through for the last 60 plus days. So
Wow. Well, you're still right in the throes of all
yeah,
of the recovery, and so I can just imagine, each what each day means to you to be able to manage, your health, your well-being, and then everything that you experienced. One of our listening audience members commented, and Clarissa said, she says, "How frightening is that?" And and you're right when you were talking about not being able to sleep, reaching out to your daughters. All of that just creates such an emotional stress and impact on the person. And it's because, in large measure, this illness is so uniquely different than so many other
yeah,
illnesses. And your sharing this is so important because I particularly appreciate your saying, Robert, you're absolutely right. Latinos are very private. We like to keep our health issues, our personal issues confidential, and we limit the circle of people who we share that information with. So you're doing something today to really help, impress on all of us the value of what your experience was like. As you said, it was the medical advice that really persuaded you to be in at the emergency room for care. And in spite of your first hospital stay, then you got rehospitalized. So it's just very telling that there's so much for you still to do in life. And I'm sure the gratitude, the gratefulness that you're experiencing, people can hear in your voice. And, I wanted to share with you something that really kind of speaks to your story, how it relates to Latinos in our country. And CDC reported recently that Hispanics are more than 4 times as likely to be hospitalized for COVID-19 compared to our white counterparts. 4 times. And so that means disproportionately, we're going to very likely experience hospitalization for a whole wide range of reasons because of COVID-19. And therein lies, I think, the opportunity to talk about what are now we all trying to do in our nation and our country to address the issues regarding COVID because of the issues from screening and testing to the vaccines that are now just beginning to accelerate the pace for folks to be able to mitigate the spread of this illness. And then there's the other issues, right? And the hospitalizations. And right now, the major study called Pass It On, which is led by Vanderbilt University, is doing an incredible job of ensuring that Latinos and those of us across the nation, for that matter, are represented in a research study that helps to really tell our story about how we're recovering from this illness, what it is that the science can tell us about these hospitalizations. And so the study is really helping to enroll Latinos in 30 sites across the country, including here in New Mexico. So the University of New Mexico Health Science Center, which is one of those sites in the U.S., we were very fortunate to connect with Dr. Raval from UNM Health Sciences, and he's actually on the floor right now at the hospital. So what's happening is he's trying to squeeze himself off the floor despite the pressures, the demands of the direct interventions, because guess what? He may be with a patient at this very moment, but his research efforts there at the university hospital means that he's still trying to make his way to our Zoom meeting here. So we're hoping he gets to join us here briefly. But if you were to, Robert, talk to folks about what would be the benefits of being able to participate in a research study like that, what would you typically say to someone? Because your experience is so telling. It really says so much. And after you respond, I'm going to go to some of the comments and questions that we're getting that are coming in. So we'll segue to those comments and questions in just a bit. But go ahead, Robert.
Yeah. So, Fred, I think with respect to the study that's being done and whatnot, I mean, when you talk about, Latinos being, 4 times more likely to be hospitalized and whatnot, and one conversation that I had with, Dr. Diaz is I was sitting in the emergency room. You can see that there's a whole bunch of different demographics that were waiting in that hospital room, right? I'm
Right.
lucky people have insurance, have some resources and everything else. But one thing that we need to be engaged in these discussions, on these trials, see how it's it'll be affecting us, our family members, because this is, I mean, the last thing you want to do, and if is have your mom and your dad or your grandparents and see them, in that hospital room by themselves, having to pass away by themselves. And if there's any ways that we can help mitigate that, I think it's important that we engage in some of these studies that you're talking about.
Well, thanks. I completely agree with you. Historically, there have been instances where Latinos weren't necessarily as included in clinical trials or research studies, and Vanderbilt University has done a phenomenal job of really working to ensure that there's that representativeness in this clinical trial. And NALBA as an organization, as an advocacy organization, very much in support of people's well-being and particularly Latinos, right? So you're telling your story of hospitalization, this UNM research site at the Health Science Center really creates an opportunity to help learn how it is that through that research study is whether the convalescent plasma, which comes from the recovered COVID patients, will actually help hospitalized patients recover faster. So there's
Yes.
some benefits. There's an opportunity to learn, and I mean, you yourself, I mean, in your recovery, is just probably a conversation you have with yourself every day. But we actually have a question for you.
Yes.
So one of our participants was taken by what you shared and what you said, and she has this question for you. She wants to know, how did you work with yourself to try to help your body stabilize the first time you were in the hospital? And did you pray or meditate, or what else did you do?
Yeah. So thanks for the question. And it's, I think as Hispanics, this is the way I grew up. I think, we're very spiritual. Our faith, really means a lot. So yeah, I did a lot of praying. I did a lot of, really trying to, meditate and focus you know, on my mental capacity. I really think that when you're in some of those situations, that your mental capacity and where you are, where your head's at, I almost feel like that's 50% of the battle. If you're not, if you're not able to think clearly and have a positive outlook and be saying, I'm gonna beat this. I'm gonna take this on, and I'm gonna be okay. Yeah, I really think that whole positive attitude and aspect is really what got me through it. And if I had to go into the ICU, I don't know if my mental capacity would have been there. So I was doing everything that I could to do what I needed to do to focus on stabilizing, my oxygen levels at that point. So yeah, just having, the faith. I mean, I prayed, I meditated. Um, it's, my brother passed away a couple years ago, and I had many conversations with him while I was just lying on that bed, and it's just, part of that faith of, what you believe in, and it kind of gets you through some of those things, especially when you're alone and you don't have anybody else, right? So making sure you have a strong mental capacity is, I really think, one of the most important things if you're in that situation.
It's a really good point. Our emotional well-being, right? Because the thing about our brain is it's one full organ, so every aspect of our neurological system is built into that organ, right? Our
Yes.
emotional, intellectual capacities all hardwired in that one organ, and it's what runs the engine, right?
Yeah.
And so you're absolutely right. If you think about the impact of being alone, being isolated, Latinos have been struggling with two things, particularly. One is before being hospitalized or treated or vaccinated or tested, people are worrying quite a bit.
Yeah.
So that's happening independent of any interventions or uh, hospitalizations. That's happening just by itself. And then there's really the emotional impact of what happens if you do get it hospitalized. And folks have been saying, you're isolated, you're alone, you don't have the natural support system, you don't have your family there. And our families are so important to us that for us to be separated from them takes away the very thing that helps us feel confident, to restore our faith. It helps us to feel bonded, el cariño, the affection, estar embrazado, give each other hugs and all that connectivity. When you get separated from that, the emotional impact it has is very significant. And, you were very clear to point out, calling your daughters. And, what was their reaction like to this? Because they clearly reacted because of what was unique to your bonded relationship with them. And then there's your extended family, right? Your parents, other siblings. Say a little bit more about that, Robert.
Yeah, so I think, again, just like you mentioned earlier, I mean, just the way we grow up, with our families, and just how important our families are to us, and just how tight knit you are. And it's, I mean, when I was in the hospital, I could barely speak to my parents, because anytime I was talking, my oxygen levels would start falling. So, my parents, I've never seen them so worried before, right? And my dad, who does not worry, you never see an emotion out of him. I mean, he was wanting to come, to take care of me and just do what he needed to do. But I had to keep talking him out of it and saying, Dad, I get this, but, you can't come because I don't want you to get infected. And I mean, and he almost like didn't really care, because he wanted to be there to do whatever he needed to do for me, right? So, I mean, there's that aspect of, being in the hospital, not being able to have your family around you. And then, yeah, the whole aspect of my daughters, I mean, just if you can just think and imagine of having to send those messages to your daughters at 2, 3 in the morning saying, I don't know if I'm going to make it out of here. And if I don't make it out of here, basically, here are the instructions to take care of yourselves, and I love you. That's a hard conversation for anybody to have, especially, and not being able to do it face to face, right? So I mean, me and my daughters, we've always been close, but I could see, especially with my older daughter, of how once I came back home the second time, oh man, I was telling everybody she was like my warden. She would not let me do anything. She would not let me go anywhere. She was like, she was very strict, and it was all out of, because I think she felt like
Perfection.
I can't lose my dad, right? So yeah, it was a very, very touching and emotional aspect of, and then I can't even imagine waking up at 7 o'clock in the morning and getting these messages from your parent that, if I'm not here tomorrow, this is what I need you to do. If you can even imagine that, right? So, I mean, it's been an emotional um, process, but I'm one of the lucky ones.
Well, Robert, so telling. I want you to know that one of our participants sends you a message and she says, "Thank you for sharing your experience." And and gosh, absolutely, she's right. You're sharing this experience is very telling because you're right. Your daughters. Oh my God, they were guarding, protecting their dad,
Yeah,
right? And your dad was doing what your dad felt he needed to do, which is take
yeah,
care of his son, right?
yeah,
We know in Latino communities, something that's very impactful is as the parents and grandparents often say, they want to pass before their children do,
exactly.
and there's a reason why.
Yeah,
And so here you are, you get to share that message and impart the importance and the significance of what it is that we can do to mitigate and protect ourselves, protect our families. Like you said, Dad, I don't want this to pass on to you, just like you didn't know where it came from.
yeah,
It means it gets transmitted in a number of ways. I think we're all pretty familiar with that. But because we don't want to take the risks, part of what we're doing is making everything possible on our part to reduce the likelihood of that happening. And so, your journey will continue here, Robert, and I know we're going to stay in touch to hear about that. And who knows, in a few months, I might just call you back and say, of course, we'll talk before then, of course,
yeah, yeah.
see how you're doing and to support you. But here's a couple of things I did hear from folks that are on our chat with the Facebook Live. Um, One of our participants says, "I felt the same about my parents before they got their vaccinations." And it reminds me of a messaging campaign that we're doing here at NALBA in partnership with the Mano y Corazon Institute. So we're developing social messaging for the Latino community, right? And
Yes.
ours says this. It says, "La cultura cura y la vacuna asegura,"
Uh,
right?
yes.
Our culture heals us, and the vaccine assures us.
Yes.
And then the punchline is, get your shot.
Yeah.
And and of course we understand there are different perspectives about that, but I got my first shot last Friday, and I can tell you I had some major side effects. I was so relieved. I was like really super excited. I was like jumping for joy, and I experienced this thing called euphoria,
Yes.
right? And so I had all these side effects, right? Positive side effects, uh, and I can't get the second one fast enough, right? So, in some measures, that's a lot of what we're all wanting to do, is to be assured that our loved ones are safe and healthy, and that's really the powerful message that Latinos have with each other is, vamos a cuidarnos. We've always done that. Our collective sense of well-being is how we protect our family. Sometimes we put our family in front of our own well-being. But here's an instance que entre todos unidos y juntos podemos cuidarnos, right? And so I think what I just want to say, and we're going to move on to you a little bit here before we get to closing, but here's something else that someone else on Facebook Live said. And she said, "What a moving and intimate story, Robert. Thank you for sharing. I'm happy to see you're getting better every day." So you have folks roaring and rooting and supporting you, not just through today, but keep in mind that this event is getting recorded. And so after the recording is done, we're going to repost it on social media. So this message will live on beyond today, Robert. So your message is going to be part of NABA's efforts to encourage people to not only uh, take care of their families in the ways that they believe, but if it includes being vaccinated, which I believe most folks believe in doing so, and then also making sure that they're taking care of each other in the best way they can, considering the limitations of COVID, but we see the light at the end of the tunnel. So that hope comes not just from the vaccinations, but also from these clinical trials that are taking place. And thank you for encouraging people to think about, participating in that. So we're going to make sure that we post here on our live Facebook how you can contact Vanderbilt University. We'll provide an email and a phone number there. So we'll show it a few times before we wrap up today, just so folks can write it down. But if they don't write it down, it's going to get recorded and they can go back to taking that number right off our Facebook live chat. And of course, Dr. Raval, who is at the Health Sciences on the floor working right now, said he would try to get in here for 10, 15 minutes. So it may be he may come in right here at the tail end of our event, but we certainly recognize that as a researcher and a practitioner, he is on the ground doing the work. And what I want to say about Dr. Rabel before we go back to you, Robert, is Dr. Rabel is a board certified clinical pathologist with a subspecialty certification in blood banking and transfusion medicine. He received his medical degree from the University of North Carolina, where he was a Howard Holderness Distinguished Medical Student Research Scholar. It's no doubt that he's involved with the Pass It On clinical trial there at the University of New Mexico Health Science Center. So, in his absence here today, I just wanted to share his bio because I would have shared this, of course, and then we'll just keep our fingers crossed that he can make it here because, as he said, the patients take precedence, but he understood that he would do the best he could. So here we are today, Robert. Tell us what you foresee for the next few months, what you want to pass on to the listening audience, given your experience. There was so much depth about what you've have been experiencing that things are different right to now for you. You can just imagine what you're hoping things will be like here in the next few months and the years to come.
Yes.
And so I'm going to just turn this over back to you, and you kind of walk us through what this future holds for yourself and your message to our listening audience.
Yeah. Well, yeah. So I think, I guess just one perspective that, again, I kind of mentioned earlier that I'm a pretty private individual. Again, I normally wouldn't have even shared this story. Well, a couple of weeks ago, I had a conversation with a friend, and I was, we were talking on the phone, and I was telling him like, well, okay. He's like, "How are you doing?" I'm like, "This is what happened." And as I'm talking to him, I can kind of just hear in his voice that it's like he almost didn't believe me, right? And just kind of like, didn't believe I was in the hospital for like 21 days, and and I was just kind of, I'm like, why would I make this up, right? And I said, well, maybe it wasn't COVID, maybe it was just the flu, or and just hearing that skepticism in his voice, and then also just having the conversations with some of my family members that are talking my uncles and my aunts out of getting the vaccine because they either don't have the necessary information or it prompted me to kind of put this out there because if I can prevent anybody from having to go through what I went through, that was what my whole goal was, because especially family and friends, and I've had a number of family and friends that have shared similar stories with me, close friends that have passed away, have not been intubated, but one of them that lost their grandfather, that that was about 5 months ago, and only now in the next couple of weeks they're barely now going to be able to have his funeral. I mean, that's not how we grew up. I mean, that's not that's not what we're used to. So if there's ways that you can protect yourselves and your families, I mean, because this is a reality that's happening right now, and you're right, there is a light at the end of the tunnel with the vaccines. I encourage my family and friends and everybody to go out and register and get them done as quickly as possible. And because the other aspect of it is, we don't know if there's going to be other variants that we're going to have to deal with, number one. And number two, honestly, I'm feeling okay now, but I don't know what the long-term side effects of this are going to be. I mean, that's one thing that I get that kind of worries me on a daily basis is, how has it affected my heart? I know I had, some damage to my lungs, but, are my lungs going to be able to get back to normal, or what are the other potential side effects that I might not even know about? And those are things that I think people are still trying to figure out, right? So, for now, I'm feeling good, and trying to get outside and work and heal myself more. But these are things that are on my mind on a daily basis, and it's kind of a day by day aspect of just trying to heal myself, spiritually, mentally, emotionally, and physically. And just if there's anything I can do to help share my story to help people understand of how they need to protect themselves and their families. I mean, that's kind of where I'm at right now.
Wow, very cool. Well, I think we just saw Dr. Raval flash on the screen, and we're going to jump right to him because Robert, we know we've been like at a rock concert, right? We're waiting for the next performer to come on stage, and we're going to take advantage of Dr. Raval being able to join us. So let me just switch over to Dr. Raval to welcome you, and thank you so much. Here you are working, doing the work of a physician, with patients, the research efforts that you're doing. I can't thank you enough for just being able to break away from that busy schedule. And incidentally, I shared your bio earlier, so I'm not going to read your bio. We're just going to say welcome to you, and just give you the floor to tell us about yourself briefly, and then of course about your efforts with the Pass It On clinical trial at the UNM Health Science Center, because you're one of the sites, 30 sites in the nation that's undertaking this clinical trial, and it's right in our backyard.
Yeah,
so,
no, yeah. No, thanks for having me, and I appreciate the opportunity to come speak here. If you ever have any questions, anyone in the audience, if you want to see a transfusion service, blood bank, how things work, more than happy to facilitate that. But yeah, in the brief amount of time we have left, and I apologize for my late arrival, but hopefully can get everything teed up. The Pass It On trial is very important. As folks know, early in the pandemic, we didn't really know what therapies would be useful and what wouldn't. Convalescent plasma has a long history of being used in a variety of different viral pulmonary syndromes. And so the thought was, well, that could probably work here too. Given the pandemic and the nature of so many different groups working on it, because everyone on the planet was affected, we learned a lot more about convalescent plasma, I think, with COVID-19 than we had with almost any other viral illness. What we found in a nutshell is that not all convalescent plasma is created equally, but anywhere from 2/3 to 3/4 of convalescent plasma is sort of what's called low titer, meaning it's just not as effective at neutralizing the COVID-19 virus compared to what's called high titer convalescent plasma, which is very good. So you can think of it as like sort of the champagne of convalescent plasma, if you will, that high titer plasma. And that's hard to come by because there's not very much of it. And so early in the pandemic, any convalescent plasma was deemed to be good convalescent plasma because it's all we had and we were still learning. Now we know that really it's that high titer, best of the best convalescent plasma that's going to be potentially useful. But even when you look at that, there's a signal that suggests that convalescent plasma at that high titer is helpful in COVID-19, but we don't know for sure. And because there's this equipoise, that's the term we use to describe a medical uncertainty. We don't really know what the best answer is. There's true challenges in saying what's the right thing to do. That's when a randomized clinical trial makes the most sense. It's to help answer those tough questions where there isn't a clear answer one way or the other. And so Pass It On is a randomized clinical trial. And the question is asking, does convalescent plasma against COVID-19 compared to a placebo, which in this case is a multivitamin solution, does the receipt of one or the other during hospitalization in patients with COVID-19 and respiratory symptoms, do those interventions make a difference? And so this is the gold standard when it comes to trying to answer a question like this. You have treatment arm, which has the convalescent plasma folks, and you have a control arm, which has the placebo. As a local site investigator leading this here, I'm blinded to what a particular patient gets. So I have no idea whether the individuals I speak with to talk about this are going to be getting the plasma or the vitamin water. It's really
Right.
just, and that's because I have to evaluate these folks, and I want to make sure that my assessment of them isn't skewed or biased by knowledge of what they received. And so it really is designed to see, does convalescent plasma, just one unit of convalescent plasma, no more volume than a can of Coke, really is going to be infused. And then the question is, does that help improve their COVID-19 symptoms over about a 2-week stretch, all the way to the end of the better part of a month? And that's the question we're looking to answer. There are other convalescent plasma studies that are trying to figure out whether you give it to a patient that has COVID-19 at other points in time, maybe when they're at home, maybe when they're completely asymptomatic, maybe when they're outpatients but not feeling well. But Pathology is unique and useful because it's really looking at the inpatient hospitalized setting. And that's where the availability of therapies is really important, because these folks have been deemed sick enough to get admitted. And now we're trying to figure out how to best manage their care. This is one sort of, the Pathology trial is one mechanism by which we can hopefully get answers that are meaningful and substantive, so that, I hope there's never another pandemic, but if there's any sort of viral illness that convalescent plasma might be used for again, there'll be this body of data to rely on.
Yeah, thank you. What a great summary. And more importantly, you'll appreciate knowing that Robert, who joined us today, shared his story about being hospitalized twice, totaling 21 days. And
Oh, wow.
he was probably seconds or minutes from being at your site. He was at your sister site across town at the other UNM facility in Sandoval County. They didn't name that after me, by the way. I would just want you to know that that's named after my distant relatives. But just, you're absolutely right. I think when you think about the benefits of what this clinical trial can do, particularly for patients who do participate as plasma donors, just what would you say to encourage Latino patients who are hospitalized to participate? Because what Robert says is, he now really clearly realizes how significant and important science is to helping us understand these very complicated medical biological conditions that really do so much harm. And how do we reduce that harm, and how do we encourage people to participate in the trial? And what would you say, Dr. Raval, about that? Because Robert said he took his doctor's medical advice, and that's why he's in recovery today. So we do take the advice of physicians because you're the experts, and you're respected individuals, and people rely on your judgment. And so what would you say to encourage folks here in New Mexico, particularly because the demonstration site's here and the study site is here? What would you say?
So no, that's a great question. And so I guess I'd kick off by saying it's really important to remember that no one's going to offer anyone a clinical trial opportunity unless they meet the criteria for that trial. And specifically for a randomized trial like this, some people might feel, well, if you think this is useful, why don't you just give me the plasma? Because after all, that'll give me the best chance of getting better. But it's also important to remember that we don't, if we knew that, then this would be part of standard of care. The FDA would have rubber stamped this for approval a long time ago, and we'd all be using it or something similar to it. But I think the important thing to remember is everything is a risk benefit. And so anytime we approach someone, we want to weigh the benefits of something versus the risks of something. And now plasma is something that's used every day in every hospital around the country. It's safer than it's ever been as a blood product, but there are some small real risks associated with plasma. Multivitamin solution, pretty much no risks. And so the whole idea here is that if we knew this was great, we'd be using it, but unfortunately we don't. And so I'd say to the community here, if you're, I hope no one else gets COVID-19, but if you do and you end up in the hospital, and at our facility, I believe we're the only one in the state that is offering this, it's an opportunity to, one, potentially add to this fund of knowledge that we know about this. Two, and this is what a lot of patients have told me that we've enrolled, is that they like hearing that we aren't just using any convalescent plasma. We are really using the best of the best. And so that, by participating in the study, you have a 50% chance of getting potentially this plasma or a solution that actually doesn't help or hurt you. In fact, it may help getting a little bit of vitamins. But no other therapies are denied because you are participating and pass it on. So all the other standard of care therapies, in fact, even some other research therapies are still available to you if you participate. So it's not like saying, oh, I'm entering into the research path, and so all these things that might help me are now off the table. In fact, that's completely untrue. Everything that we have here is still available. And so this is really just an addition, not a replacement of the things that we can offer.
Oh, wonderful. Well, I want to pass on to both of you some of the comments on Facebook Live, since we've been taking questions or sharing the comments. And Marcella says, great information with an exclamation mark on it. And then Adela says, thank you with an exclamation mark on it. And it really speaks to, the value of how these pláticas, these conversations, help get information out to the community by folks like yourselves. Robert, whose firsthand experience has just left us all very much paying attention to what we need to do to take care of ourselves, and what we do to reevaluate how we've been doing that and what we might do different. And then yourself, Dr. Raval, for being able to come off the hospital floor to be here with us today and to share this information. So I'm going to give you both an opportunity to make your final comments, and we'll wrap up that way. But Dr. Raval, I'll just go to you, just because we're kind of on a little roll here with you, and then we'll end with Robert, and we're going to conclude in just a few minutes here. So go ahead, Dr. Raval.
Yeah, so I'd say one, thanks to the community, none of this would be possible without folks donating plasma to be used in this study. And so the blood donor community has really come together, and that's many of the people likely on this telecast today. So thank you to you. Passed On study is just one of several important trials that are happening, but it is a really important inpatient study trial. And I think we're going to have answers now that in another time may have taken years or decades to get together, and now we have the chance to answer this question again, not just for the current pandemic, but to help inform future treatments for viruses that affect the lungs as well. And so I'd say thanks to the community. Folks have gotten lots of questions to us about this trial as well as convalescent plasma in general, and I think it's been rewarding to be able to be a part of this in a lot of ways, because while we can't guarantee that something's going to work like convalescent plasma, we know we're doing the best we can to do right by our patients. And so I think I credit UNM's leadership as well for saying we don't want to give convalescent plasma indiscriminately early in the pandemic. It was tempting because it was convalescent plasma. It made it sound like magic almost when you would listen to it in the radio and on the news and on TV. But what we learned is that not all convalescent plasma is created equally. And even, again, as I mentioned earlier, even if it's the best convalescent plasma, we still don't know if it has that ideal effect that you'd expect when you're given any treatment. And so that's what we hope to get that more information about. We'll pass it on.
Wonderful. Well, the Pass It On clinical trial efforts are to try to ensure we get Latinos, participating in these trials, and we're getting close to the number that we're hoping we can accomplish. Right there, have 1,000 participants nationwide, and We're just trying to inch and encourage Latinos, and particularly here in New Mexico, because we're all here. And I know you're definitely very much in New Mexico because you're wearing a Lobo jacket there, which I want you to know, I don't want Robert to take offense with that since he's an Aggie, but
oh, gotcha. I'm learning, as someone who's been in the state for a few years, I'm learning about the differences here.
Yeah, and there's one there, of course, but what's important is here we are working together in the way that New Mexicans truly do, which is to collaborate. And as we say, una mano lava la otra y las dos lavan la cara. One hand washes the other and both hands wash the face. So here we are washing our face.
Well,
Robert, we're going to
I just wanted one final comment. If anyone in the listening audience has any questions, or if you have a loved one or a friend who's in the hospital and you have questions on their behalf, don't hesitate to reach out to me. My email and contact info is on the UNM website, so it's not a secret. I'm more than happy to answer any questions. It doesn't mean you have to enroll that person in the study. Even if you just need information, I'm happy to get that to whomever needs it. So please don't hesitate to reach out.
Oh, that's great. Yeah, thanks for making yourself accessible. We'll add it to the Facebook chat box, by the way, because we're recording today's session and then we're going to replay it. So it gets replayed nationally across the country. And we do have viewers from other parts of the country listening in today, but it's going to get reshared and it'll be seen hundreds of times over after today. So thank you very much, Dr. Raval. And Robert, bring us home. I want to say thank you. Gracias, hombre. Your story was so powerful, and I know it's going to resonate for folks in our state and across the nation. So we'll have you say final words.
Yes, Fred, thank you for having me on today. And Dr. Raval, thank you for all the work that you're doing. The frontline workers, doctors, and whatnot. I mean, you guys are so appreciated. I know this is such a really tough time, that you guys are having to deal with. So thank you for everything that you guys are doing. I guess just final last words, and really to share with our community that, I do think that there's light at the end of the tunnel, but I also do think that does include part of, getting vaccinated and doing our parts. And until we're out of the woods, continue to mask up and social distance. But at the end of the day, this is real. I mean, I lived this firsthand. I'm one of the lucky ones that, was able to get through it at this point. But, we don't want to have our parents or grandparents, our loved ones, be in a situation where, they're in this alone. And so let's all do our part to make sure we get out of this, once and for all, and stay safe.
That's awesome. Thank you, Robert. And I'll close with one of the remarks from our Facebook Plática. So powerful hearing how family, faith, and community assisted in your recovery. Gentlemen, it's been such an honor, a pleasure. Thank you for taking time to be here with us, knowing what was involved to make this possible, and your insights, wisdom, and experience and expertise is greatly appreciated. And so even though we're saying goodbye, it means we'll still get to see each other some other time. But gentlemen, thank you very much. I appreciate it.
Thank you, Fred.
Bye-bye.
Thank you for having us.
Bye.